Hello, I'm Steve Lipsky, and I'm a pediatric ophthalmologist here at Thomas Eye Group. I went to undergraduate college at Union College in upstate New York. I went to medical school at the State University of New York at Buffalo. I did my internship at Lenox Hill Hospital in New York City. My ophthalmology training was at Manhattan Eye, Ear, and Throat Hospital, and my fellowship was with Eugene Helveston in Indianapolis, Indiana. I've been lucky enough to be a member of the Thomas Eye Group for the past 12 and a half years. I'm a pediatric ophthalmologist. As pediatric ophthalmologists, we address all aspects of pediatric ophthalmology and pediatric eye care, as whether it is just fitting a child for glasses or dealing with lazy eye where eyes don't see well as surgical treatment of tear ducts, eye misalignment, cataracts, glaucoma, ptosis, which are droopy lids, and a myriad of other conditions. When I was going through my training in ophthalmology, I had many different subspecialties to choose from. And I was very attracted to oculoplastic surgery, but ultimately my first love was care of children. And I thought about becoming a general pediatrician, but I could not give up the surgical part of my practice. And so when I found that I could not give up the surgical part of my practice and I could not give up the pediatric part of my practice, a perfect combination was pediatric ophthalmology. When we work with a small child, the work that we do today may carry forward through that child's life for over 100 years. And we can take time now in a few months to work with a child who has decreased vision in one eye and potentially give that child good vision in both eyes for 100 years. I think the most important thing when meeting a child is to address the child as the most important person in the room, and also to address the child with a smile. Children pick up on those subtle cues very well, and we like to make them feel comfortable, feel at ease, and make them feel like they're important. Parents are often more apprehensive than their children about coming to the eye doctor. They're worried about, will the child be uncomfortable? Will the child be happy? Will the child experience any discomfort? Will the drops hurt their child? And I think what's important and what we try and relay to the parents is how we're going to take good care of their child, and we're going to make it a fun experience for them. If they give us an opportunity to work with their child, they'll find almost all the time that the child has a great experience, and as a result, the parents have a great experience.